Hello everyone, welcome to another episode of Diabetic Diaries. I'm Sophia and I'm joined by my wonderful co-hosts Vivian and Michelle. How are you both doing?
Hi Sophia, doing great.
Same, I'm looking forward to today's episode. Today we're delving into gestational diabetes.
Let's start with the basics. Vivian, can you give our listeners an overview of what gestational diabetes is?
Yes, so gestational diabetes is a type of diabetes that develops during pregnancy. It affects how our body uses sugar and it can lead to complications for both the mother and the baby.
It's important to note that gestational diabetes usually develops around the 24th week of pregnancy and, in many cases, can be managed with lifestyle changes.
Michelle, what are some of the risk factors for developing gestational diabetes and how is it diagnosed?
Good question. Risk factors include being overweight, having a family history of diabetes, or being over the age of 25. As for screening, most pregnant women are tested between 24 and 28 weeks of pregnancy. The oral glucose tolerance test, or OGTT, is commonly used.
It's crucial for expectant mothers to attend prenatal appointments and follow their healthcare providers' recommendations for screening.
Vivian, how is gestational diabetes managed during pregnancy?
Managing gestational diabetes involves a combination of healthy eating, regular physical activity, and in some cases, insulin or other medications. It's a team effort between the mom-to-be healthcare providers and sometimes a nutritionist.
Support from family and friends is also vital during this time. It can be emotionally challenging, so having a strong support system is incredibly helpful.
Michelle, can you shed some light on how gestational diabetes can impact both the mother and the baby?
Certainly, Sophia. If not managed properly, gestational diabetes can increase the risk of complications during pregnancy and delivery. The baby may be at risk for a high birth weight and other health issues. For the mother, there's an increased risk of developing type 2 diabetes later in life.
That's why early detection and effective management are so important.
Thank you both for sharing your insights on gestational diabetes. Before we wrap up, any final thoughts?
Just a reminder for expectant mothers to attend prenatal appointments, follow the healthcare provider's advice, and prioritize their health during pregnancy.
Absolutely. Gestational diabetes is manageable, and with the right support and information, women can have healthy pregnancies and deliveries.
Thank you, Vivian and Michelle, and thank you to our listeners for joining us on this episode of Diabetic Diaries. Until next time, take care and stay well. Let's start by understanding the basics. Vivian, can you share some key facts about diabetes and why prevention is crucial?